The world is rapidly changing. It is home to 800 million more people than a decade ago. More people live in cities and travel than ever before. With many new partners working on global health, political leaders are realizing that health is essential for people and countries to reach their full potential. And that's why the World Health Organization works to make sure that everyone, wherever they live, has access to medicines and essential health services when they need them. Based on research, WHO sets standards and makes recommendations that protect people as they grow, live, work, and age. It's all linked. Enable children to survive and reach their full potential. Ensure their mothers have healthy pregnancies and can continue to contribute to society. To ensure people enjoy longer, healthier, and more productive lives, we find new and better approaches and then work hard to put innovation into action. We've seen results. HIV mortality has been cut in half from 2005 to 2015. Measles vaccines have prevented more than 20 million child deaths since 2000. WHO is assisting more countries to move towards providing universal health coverage so that everyone has access to affordable health services. But there's still a lot of work to be done, whether it's rapid response to an epidemic or cultivating local partnerships with people on the ground. WHO is a driving force for a healthier world, boosting the trajectory of lives saved and laying the foundation for better health for all. Solutions for a healthy world, for everyone, everywhere. WHO stands as the guardian of health.